Hi everybody, welcome to our weekly training video. This week we're going to be talking about considerations for grooming and vet care when you have a dog who may need something done but they're not really ready for it. There's going to be some trauma involved, potentially a lot of stress. And so how can you think through this process? What do we need to get done? Is there anything we can do that to reduce stress, working with your veterinarian and your trainer? So if you have a dog who needs to be groomed or needs some vet care, this might help you kind of think through how to handle it. So vet care and grooming for fearful dogs, 4 tips for minimizing stress. Who is this for? This is for you if getting your dog to the vet or something about the appointment itself is going to be traumatic, or to a groomer. If you can't do basic care at home without force, so without, your dog doesn't really want it and you kind of restrain them and force them to endure it. If you know your dog needs some kind of care now or soon, but you really would like to minimize the emotional and behavioral damage. And we would all, of course, like to do that. All right, so step number 1 as you approach this problem is to talk with your veterinarian about priorities. Is there anything that absolutely has to be done now? What can wait? A lot of times, a lot of things can be pushed off a little bit if they need to be, if it would give you more time to say, try out some pre-visit drugs or do some training to make the process less stressful. So see what can wait and what absolutely can't wait. There are also some things that are kind of done routinely in a vet office but don't always necessarily have to be done, things like taking a rectal temperature. Ask your vet, do we have to do this? Is this something we could skip? All right, now you've got your priorities from your vet. You know what absolutely has to be done, what can wait. Now talk to your vet and your trainer about less invasive options. So a lot of times there are other things you can do besides sort of what the standard method is of getting something done that might be easier for your dog. This photo here is Pancake posing with his nail board. That's to remind me to mention nail care. So often a dog's nails will be done at the vet clinic if they're too fearful to be done at home. They don't like their feet handled, but it can be kind of a scary experience because they're forcefully restrained and they may struggle and cry. And it would be probably much less stressful if you could talk with your trainer about other ways to get nails worn down, such as training your dog to use a nail board or walking on abrasive surfaces. There are different types of thermometers that veterinarians can use, and some may be less stressful than others for your dog. There may be different kinds of restraints depending on your dog's preferences and what they're most afraid of. Even some vaccines, there may be different methods of delivery and some might be easier for your dog than others. So it never hurts to ask your vet, hey, is there any easier way to do this? Now, when it comes to grooming, there may also be steps that could be done more gently or could be skipped. And so that's something to either discuss with your groomer, or if you're doing it at home, think about, do I need to blow dry my dog, for instance? Maybe that could be skipped if it's going to be really, really stressful. Or could I just towel dry them? I suppose we need a less invasive option. Step number 3, or tip number 3, talk with your vet about medications you can give at home before the visit. And this could be a vet visit. It could be a visit to a groomer. There are lots of options that may be appropriate for your dog. It's usually a good idea to work with your veterinarian to test out any different combinations you're considering or different doses that your veterinarian recommends at home when you don't actually need your dog to go anywhere, to see how your dog is affected before you actually need to use them for an appointment. So talk with your vet about medications, pre-visit medications. Tip number 4, talk with your vet about sedation. Many things that a quote unquote normal dog wouldn't be sedated for at the vet clinic, a very fearful dog will need to be sedated for. So for instance, any vet care that Pancake gets, he is sedated. So whether that's checking his ears, checking his teeth, taking blood, doing a vaccine. We have a plan in place where he's pre-medicated to be a little bit calmer, and then he receives a sedative shot when he gets to the clinic, and then nothing is done until he is sedated. So talk to your vet about options for your dog if that might be appropriate. And kind of a bonus tip here, if you can, avoid trying to be one of the bad guys when it comes to vet care and grooming. Probably regardless of how careful you are and how well you plan, there's going to be some unpleasantness associated with necessary vet care and grooming when your dog is really fearful. And as much as you can let the vet or the tech or the groomer perhaps be the bad guy, the guy that does the bad stuff to the dog, that may protect your relationship with your dog a bit more. As an example, in this photo here, this is our wonderful veterinarian Rachel, who is carrying Pancake from my car into the clinic in a crate that is covered. At one point, Pancake was in his booster seat, and I picked him up and just held him for the sedative shot, thinking that might be less stressful for him. And for the next several weeks, every time I tried to pick Pancake up, he snapped at me. So I had damaged my ability to pick him up and associated me picking him up with bad stuff. So from there on out, I always asked the tech to, I'd have him in a crate or carrier and just say, I can't be involved with the handling for the shot because then I won't be able to pick him up. All right, so in summary, if you are considering getting some needed vet care or grooming done for your fearful dog and you know that they're not going to like it, it's going to be hard for them, ask your vet what absolutely has to be done and what could wait for additional training or other accommodations to be made. Talk to your trainer or vet, or groomer, depending on what procedure is in question here. Is there a better way, a gentler way to do it, a way that's less invasive? Ask your vet if you can potentially pre-medicate your dog prior to going to the clinic or groomer, and whether sedation for a vet visit is an option. And then finally, if you can, try to avoid being the bad guy and being involved in any scary stuff your dog might experience. All right, everybody, I hope this helps you think through your decision-making process as you get ready to get your dog the care they need. If you would like our weekly tips delivered to your email inbox, go to the link at the bottom here, dogkindtraining.com/newsletter, and put in your name and email there, and then you will get a link updating you when we have new material available, as well as any new offers or special deals on services. I hope this helps. Have a wonderful week, and I will see you next week.